Hi, my name is Limana, and I'm going to be talking about the cervical cap. The cervical cap is a plastic cup that is entered through the vagina and placed on the cervix. Using suction the cup to make the cup stay in place, and there's a handle for easy removal. But the cup must be used with spermicide for it to be prevent pregnancy effectively. This method is for female bodies because it goes over the cervix, so a person with male body cannot use this. Um, this option only helps prevent pregnancy. STIs, it does not help with at all. Um, this is a long-term pregnancy option because it can stay in for years, and it's something that it's supposed to stay in and not be taken out regularly. Um, the cervical cap can cost from $0 to $270 depending on your insurance. Um, for the doctor's visit and then the insertion. Um, this method is non-hormonal and only uses spermicide and blocking the sperm to get into the uterus instead of using hormones. Um, this device looks like this. Um, this is like actual size on your hand, so, and then this is what it would look like in the vagina. Um, the device works by, first of all, blocking the sperm from getting to the cervix by blocking off the cervix. And if any sperm do get through the cervical cap, there's spermicide to kill the sperm. Um, so pretty much we're blocking the sperm from getting to the egg. Um, this method does not work very well. It's only so far it's said to only have a 71% effective rate. Um, which I don't know, that doesn't make sense, but I would say that this is somewhat effective. It's not the most reliable. Some disadvantages to this method is that it does not prevent STIs. Um, it can make it can have it does not prevent STIs. So you have to make sure that you and your partner are either um, taking other steps like using a condom with this to prevent them, or making sure that you're in a monogamous relationship and STIs are not a problem between the two of you. This method also does not work as well if you have given birth vaginally. If you have, because when you give birth vaginally, your cervix stretches, and it will not go back to the same tightness after you've given birth, um, and it won't fit properly. And three, the spermicides can cause problems in your vagina, like having an increased STI rate due to the little cuts that can happen, and it can cause various infections in your vaginal and your vagina and urinary tract. It can also cause pain on both sides. But some advantages to it is that um it doesn't affect your fertility. Once it's out, you're back and ready to go to wanting to get pregnant. Um, this can also be used right after you're giving birth, even though it doesn't work as effectively. But most birth controls you can't use right after you're giving birth, so this is something that you can. Um, it also doesn't require a partner's cooperation. So if you are wanting to make a decision for yourself and your partner is trying not to let you do that, you can make this is completely on your own. You don't have to worry about them doing their part so you can make sure that you are good. Um, my personal advice would make sure that you are talking to your partner, because this does not prevent STIs, and it's easier to contract infections. You have to make sure that um, that your partner is that you and your partner are making sure that everything is clean, and making sure that you and your partner are aware of how risky it is of contracting an STI if you two are not completely monogamous. Um, yeah, I'm done.